Hello, everybody. I am Dr. Rahul Nagpal. I head the Department of Pediatrics and Neonatology at Fortis Hospital, Vasant Kunj. First of all, good day to you all and a happy Children's Day. Today being 14th of November, we all know children are the most precious treasures and resources of our country and in fact anywhere in the world. Today, I'm going to talk about how the pollution affects us, mainly children, and what little bit can we do to avoid this pollution hazards which our children face from day to day. There has been enough accumulated evidence that children's health is adversely affected by pollution. If we take a child right from pregnancy, there are issues in the pregnancy, in the newborn period, in the childhood period, in the adolescent period. First, let me list out what can happen and what can we do to avoid these pollution hazards. Today, I will be talking only about air pollution, as this is most important currently. In pregnancy, it has been observed and scientific documentation is there that mothers who are exposed to pollution can have intrauterine growth retardation, meaning the babies can be very small and there is likelihood of premature deliveries. And these premature deliveries lead to further morbidity in the sense that babies are born too early and all the hazards of preterm delivery, their resuscitation and their stay in the hospital increases. So first thing is pregnancy, prematurity, intrauterine growth retardation. When the newborn comes, and if it is a full term, he's coming from relatively a sterile environment and is dependent on the mothers, on the needs. There is no oxygenation. There is required for the baby in utero. But suddenly he is exposed to an environment and sometimes which is polluted. These babies are vulnerable at this age. Their metabolic systems are not well developed. Their immune systems are very ill developed. The lungs are still maturing. And at this time, if the pollution hazards are there, there can be long-lasting effects on the lungs. So it is so much important in the newborn period to protect them from the hazards of pollution. We say that, in fact, recently in the WHO studies, it has been proved that almost 150,000 deaths have been reported directly related to pollution all over the world in children who are under 5 years of age. It's a huge amount. And not only this pollution increases the susceptibility of this child to develop asthma. In Delhi alone, in the National Capital Region, we have an incidence of asthma of as much as 8% of all school-going children. It's a huge amount if we calculate in exact numbers. And pollution aggravates it. What it does is it triggers the respiratory system to develop asthma. A person who is already asthmatic or breathing hard, it aggravates the situation. The third is that the symptoms and the signs, in spite of medicines, remain much longer in these individuals who have been exposed to asthma. That is one part. Not only that, children are vulnerable. They are, as I said, in any case, They are exposed to a lot of viruses and bacteria at their age group, and pollution acts as a catalyst to increase this infection rate, leading to more absence of school, and also the infections don't go away easily. During the recent pollution days, which we saw in our own hospital, our hospitals and our children were, the OPDs had increased by 40 to 45% with respiratory tract issues. Our admission rate with respiratory rate infections had almost tripled. This is a practical aspect of pollution in our environment. So infection, premature deliveries, asthmas, allergic reactions are all one part. Then there can be other effects. It has been mentioned, and it has been clearly proven that in older people, perhaps cardiovascular events are more pronounced at this time of pollution. Cardiovascular events like heart attacks, etc. There has been a theory, and it's only a theory, that there can be development of cancers, but it has yet to be proven. In children, also, it has been proven that there can be neurodevelopmental defects. It could be because the children who are born in polluted environments are already small, or it is a direct effect of the air which we breathe. So these are, in fact, some effects of air pollution. What can we do to help our children? The environmental factors, what our governments can do, public government together can do, is beyond my scope. But what we can do at individual level is reduce the indoor pollution at least. So what do I say? I say ventilate your room, open the room. Now there can be 2 points. The house is there, the environment outside is so polluted, why should you open the room? But whenever you have a chance, ventilate the room. It is so much important. Please also ban smoking, something which can be done easily at home. Smoking is the worst pollutant indoors for any children and for pregnant mothers. So ban smoking inside. There are a lot of air filters, ACs, etc. being used. Everything has filters. Wash those filters. Vacuum your beds. Vacuum your mattresses. Vacuum your carpets. In fact, reduce the carpeted area of your house during these times. Use microfiber dusters to remove the dust and for swabbing, etc. And as I said, after ventilation, you must clean clean every nook and corner. There can be fungus in the moist areas. That should be covered up. A lot of smells are in our homes many times. Please do not use strong perfumes. Do not use cover-up smells. We use incense, etc. And some children can be triggered with these kind of allergic reactions, like including asthma. We could wash, if we have pets, we must make sure that the pets are washed and cleaned regularly. Last but not the least, the use of air purifiers. Yes, it does help if used properly. If the correct air purifier is used for that particular area of the room, it is useful. There are many times when parents ask me this question and they say, look, if we air purify our room air, ultimately the children are going to go out, so it reduces their immunity. I don't agree with that completely. While it is true that we need to be conditioned, But why not give our children, newborns, at least a good air, even for 8 hours, 10 hours, 12 hours, or whatever time? Children during heavy pollution days, they should be told not to go outside. As I said, this is the indoor pollution which we were talking about. Please vaccinate your children at proper times. As I said, all the diseases are aggravated because of these, because of the pollution effects. While I am at the topic of pollution, I will move on to a little different subject, but it is aligned at this time, at these times, and that is the care of newborn babies during these oncoming winters. I think that is a very important subject because a lot of parents ask me routine questions: how to bathe the baby, how to take care and how to dress the baby, what should be done, what should not be done. There are a lot of myths around taking care of the baby during newborn. So uh, let me try to explain few things which I would want you, which would be my advice. We all know newborns are vulnerable. They are vulnerable to extremes of temperature, whether it is heat or cold. Babies develop cold and flu very often because at this time of the winter, a lot of viruses are moving around, and like rhinoviruses, RSV or respiratory syncytial viruses, influenza, parainfluenza, and well, now COVID. So children, babies are vulnerable from us adults. We carry infections. So the first thing which we need to do, take care of the babies, is to maintain our own hygiene, our own care, because if we are not infected, we will not infect the babies. The first thing is, please wash your hands. Washing hands is the single most important thing before you touch the baby and before you pass on the infection. This is so important. If you are suffering from colds and cough, please do not touch the baby, or please do not go near to the baby. Sometimes mothers have colds and coughs and they ask me what to do. I tell them, please breastfeed your baby as much as is possible, but cover your face, use a mask. How do we take care of bathing? A lot of people ask me how to bathe the child. What is important? Should we bathe every day? Should we not bathe the baby on winters at all? Just we should sponge it or not? Please remember, each baby is different. What is important is that you maintain the temperature of the room where the baby is being cleaned, washed, or bathed. The temperature which we say for newborns should be in the house should be 25 to 27 degrees centigrade. And in this temperature, if you give a bath to a baby with lukewarm water, it is all right. How many times? Let your baby decide. If your baby enjoys the bath, let him wash him and bathe him every day. If he is uncomfortable, as I said, all babies are different. And if he's yelling all the time, it may not be a good idea to bathe him every day. It is all right to keep him clean. Then sponge him, bathe him, say 2 to 3 times a week. A lot of people ask me again, how do we cover the baby? Yes, it is important to cover the babies, keep them warm, but don't go overboard. Always dress your babies in layers. The lower more the layer which is touching the skin should preferably be cotton. And because their skin is very delicate and it can get irritated with, say, wool, etc. So the lowermost should be cotton. And then depending on the weather and depending on the environmental temperature and depending on what room temperature you want, you can cover the baby. Remember, the simplest formula inside the house is the mother requires X number of layers, baby will require X plus 1 number of layers. So just 1 layer extra. Always cover the head. The head forms a biggest surface area of the baby and they lose heat from that area. So cover the baby's head, make him wear a cap or comfortable cap. I see a lot of children coming with wool caps on their head and they are sweating over with a string tied here with the rash and the skin on the skin here where the threads are tied. And not only that, that wool thread causes irritation to the neck. Sometimes it leads to allergic reactions and sometimes it bites into the skin. It is so tightly placed. Please put on good fitting, warm caps, necessarily not woolen. They can be fleece caps. They can be, the market is full of different kind of material. When you're going out, please cover the hands and feet because it is important. Their hands and feet get cold very fast. These children cannot maintain their body temperature as well. There's a very popular statement amongst us doctors, pediatricians, which is KMC. What does KMC stand for? Kangaroo medical care. When the baby is put against your own body, that gives particularly of the mother, that gives the warmth to the baby. And that is one of the best ways to keep the baby warm during harsh winters, even inside the house. So this skin to skin temperature promotes the baby to come closer to the mother. The mother when holds the baby, all the emotions flow. It increases the breastfeeding. And also the baby, when feels the heartbeat of the mother, when he is close to the mother, gets secure and sleeps better. So KMC, as I said. Now, the nutrition in these times is very important, particularly for babies. Breastfeeding is the best. Sometimes we forget that the babies will not demand feed if they are in a hot environment covered with wool and other things. They'll keep on sleeping. Please remember that temperature should be comfortable. I would not like to put the child under very heavy blankets, etc. It restricts their breathing. It kinds of it makes them feel as if the baby is comfortable, but he is not comfortable and he may get dehydrated. In fact, breastfeeding is the single most important nutrition of the baby. Please do not forget to give vitamin D 400 international units every day to your baby, particularly in the winter months. It is so important because we hardly expose the babies hardly get any sun, and vitamin D is so important. Well, in short, that would be my messages to you. Have a great day and happy Children's Day once again. Thank you. Any questions? I would be happy to answer.
Doctor, there is a question that we have put in chat window from. Yeah. So we'll be posting few questions that are there from the audience.
I am happy to see them. So the first question is from Mr. Somnath Banerjee. How do we educate the parents in rural areas about the possible side effect of household pollution and its correlation with hypoxemia, which is a major killer for children? Well, it is so important to inform the parents the side effects. I think it is not only the government's duty, it is our duty also. And as you correctly said, the education is the only important thing. And this is one effort from the Fortis Hospital, where we want to reach every household to tell you that indoor pollution can cause havoc in rural areas. And if this helps in rural areas, when we are cooking indoors, and in winters particularly, and when there is no ventilation, no exhaust fans, we can cause uh, oxygen levels tipping far below even what is outside in the environment, which causes hypoxemia and all its related effects later on. So the only way is to have dialogue by various means in the schools, in the colleges, and maybe in the rural area, in the gram panchayats, wherever. So the other question is, does air purifier available in the market the best option to tackle the internal air pollution? Well, Vidiji, I have already mentioned a lot of other ways. I told you that air filters, air conditioner filters should be clean. You should vacuum the house. You should not use the cover-up smells like incense, etc. Do not use strong perfumes. Ventilate your house and use the microfiber dusting dusters. Yes, one way is air purifier in combination with all other things which I have told you. How accurate are the AQI, especially in the high density area like NCR? See, we are, it can be fairly accurate if used nicely. We are now measuring PM10 and PM2.5. PM means particulate matter. So let us talk about particulate matter. The higher the particulate matter, we kind of, it does not enter our respiratory system. Anything which is between 5 to 10 microns, it will stay up to their nose and throat, cause you nose irritation, throat irritation, eye irritation, but it does not enter your farther than that. Between 2 to 5 microns, the air pollutants enter your respiratory system. They can reach your bronchus and windpipes. Less than 2 enter your alveoli, your lung situations, which is the most dangerous. And sadly, less than 2 is not measured in our country as well. It is only more than 2, 2.5 to my knowledge, which are measured. Yes, to answer your question, they are fairly accurate. Any other question? Thank you. How can community health provider be mobilized to educate caregivers about the dangers of household air pollution and its potential consequences? Well, you probably answered your question yourself. We have to take their classes, we have to take their ASHA and ANMs. We need to, not only the government, but the NGOs and probably the hospitals who have a social responsibility must hold their classes and tell them about the household air pollution and its potential consequences. Yes, you're right. How majorly it affects to asthmatic kids? I think a huge amount, Ishaji, a huge amount. And I can predict seasons. I can predict time when the pollution comes, and I can tell myself that, yes, in next 48 hours, I am going to get more asthmatic kids. I don't have any figures for it, but in my thought process, maybe it affects by at least 30 to 40%, because that's the increase in OPD which we see. So your question is, indoor air pollution is worse than outdoor air pollution? Any kind of pollution is bad. So let's not try to compare the two. But yes, indoor pollution is as bad as outdoor pollution and can be worse in many circumstances, and particularly in places where people smoke. And as mentioned earlier, when there is cooking inside without any ventilation. So there are questions like, is the food item that we should increase in our diet? Like people say jaggery helps in fighting air pollution. Yes, there is some evidence to say that, but unfortunately it cannot be a complete fight. However, having said that, babies cannot have it, and we avoid all sugar things less than 9 months of age. But yes, perhaps in older people it does help. Basically, you are entrapping the pollutants in from your food. Can we consider, the other question is, can we consider landlocked geography of Delhi as one of the major reasons of the poor AQI? This is Shubham Sharma asking. Well, I'm not an environmentalist nor a scientist based on this. However, in my own opinion, it appears so. It appears most likely because when we see whenever we have winds and good movement of the air, it goes away. So perhaps yes, even though the factors remain the same. Any other question? So somebody asked me, are N95 masks effective? In fact, we tell many people who have to work indoors, outdoors, with and in hazardous areas to wear N95. Yes, they are effective. They are definitely effective. People who are working in polluted areas must wear outside N95 masks. How much help do they give? I cannot put a figure to it, but yes, it does. They do affect. They in fact um, cut off the pollutants from from the breathing going into the respiratory system quite effectively. Thank you.